Dissociative identity disorder, formerly known as multiple personality disorder, is a mental disorder in which a person is affected by severe trauma during their early childhood. This usually includes extreme, repetitive, physical, sexual, and emotional abuse. In this disorder, personalities are created within an individual in order to help cope with the trauma. In this skit, you're going to see Dr. Ward, played by Jill, interact with Miss Smith, who is affected by DID. She has 4 different personalities: Olga, who is about 20 years old, aggressive, violent, and suicidal. Courtney is about 40 years old and is the comforting one. Taylor is a 19-year-old gay man, and Susie is a 15-year-old innocent child.
With you.
Thank you.
Hello, Miss Smith. How are you today?
I'm not Miss Smith. You know that's not my name. Why would you call me that?
Oh, sorry. How are you today, Olga?
I want my son.
But you know he's not here.
Oh yeah, that's right. He's not here. It's okay. No, I want my son. You took him from me. Give him back.
Come back to your seat. It's going to be okay.
Aw, honey, why don't your clothes match?
It's Casual Friday. Please sit down.
White Nike socks? At least make sure they're black. A Wolfpack shirt under your coat?
Miss Smith, please sit down.
My name is not Miss Smith.
Miss Smith, please sit down on the couch. I have some questions for you.
Only for candy.
Now, Dr. Ward will begin using the humanistic therapy to question Miss Smith in order to get an insight on why these personalities exist within Miss Smith. He's trying to figure out the reason to why Miss Smith has dissociative identity disorder. Dr. Ward is already aware of the abuse that Miss Smith has dealt with as a child.
Okay, so what images do you get when you think of your mom?
Bruises, a lot of hatred, and I cried a lot.
Okay. I want you to take a deep breath and just think back to when those feelings were the strongest.
Okay.
Can you explain what happened?
She used to come home, and she'd be acting really funny, and then she would hit me.
Okay.
Dr. Ward will also use a procedure called EMDR, or the eye movement desensitization and reprocessing method, which is used by psychologists to help the individual lose their emotions towards the trauma they've experienced. EMDR helps the patient lose connection with the traumatic events that have changed their lives. Dr. Ward will use EMDR in order to help Ms. Smith get rid of the trauma caused by her childhood abuse. Dr. Ward's goal is to enable Ms. Smith break down her separate identities and unify them as a single one.
Alright, I want you to hold these tappers, one in each hand. They're going to vibrate. I'm going to keep it at a comfortable level, okay?
Okay.
Alright. Now close your eyes and think about what you just told me.
Okay.
Alright, what do you think about yourself in that moment that you just described?
I felt horrible, unwanted, unloved, uncared for. Now that I look back at it as an adult, I didn't deserve any of that as a child. What did I even do to make them so angry? I wasn't a boy. Apparently all their problems were based off of that. But I tried. I really did.
Do you remember a specific event that happened in your childhood?
My mama came home from work one day, or at least she said it was work. I'm pretty sure it was the bar. And her and my daddy started fighting. And somehow, I came in the middle of all of it. All I was doing was watching TV, I believe. And they just took all their anger that they had for each other off on me, an innocent little child. I didn't deserve that. It's okay. Don't worry about it. I just didn't deserve it.
It's okay. Here, we're done for the day. That was a good session.
Dr. Ward has found the source of Ms. Smith's multiple personalities, which is her childhood abuse. Olga exists as a result of the anger in her childhood. Courtney was developed in order to repress those feelings of frustration. Susie's innocence is Ms. Smith's way of coping with her lost childhood. And finally, Taylor is there to help Ms. Smith deal with the fact that her parents always wanted a son. With EMDR, Ms. Smith will now be able to associate the calm vibrations of the tapers with her traumatic experiences and be able to reduce the frequency of her personalities until it completely disappears. Also, combined with therapy sessions, she will be able to unify her identities more effectively.